Guys, it's November the 4th, 2024, and I hope everybody's been having a great day so far today. It is about 4:30 here in the afternoon, and you can definitely tell that, the time has changed, and it's starting to get dark really early. Kind of miss those long summer days now, but the one thing I do not miss is the summer heat. We're starting to cool off a little bit here in South Carolina. Not as cool as a lot of other places. I'm sure there's some other places that are hotter than here, but we're probably sitting at about 70 degrees or something like that right now. And it's cooling off a little bit at night, but it's starting to get pretty nice, especially at nighttime. The mornings are a little bit brisk, but we don't really start to get chilly until around December, January, February. It's usually towards the end of December before it really starts to cool off here in South Carolina. But I'm looking forward to it. I like jackets and I like to wear the warm clothes and all that good stuff. But enough about the weather and the time changing. It's just funny, yesterday afternoon, I don't remember what time it was I filmed. I think it was like 5:30 or something like that. But man, it was dark. It was dark when I was out here. I'm surprised that I was able to film that video because it really started getting dark on me yesterday. But after doing yesterday's video, today I was thinking, and like I said, I had a doctor's appointment this morning that I had to go to. Also, I had to go see my dentist today, and they went ahead and did the final fitting on my partials, which I'm really excited about. I guess they do like a wax, it's like a wax fitting. It was actually the metal parts that go into your mouth. It's like a retainer almost that fits in the top and the bottom. But they went ahead today and they snapped them in and did the last fittings, and they'll be sending those back off to the laboratory. And I've got an appointment for next Monday for the final. They're going to be putting them in next Monday for good. And I already know that it's going to take me some work to learn how to talk with those in my mouth. Because I had to put them in today and was doing some talking with them in, and it really created a lisp when I was talking because it's like sits on the roof of my mouth and up and down at the bottom, like below my tongue. So I don't know. I might have to take those out in the beginning when I'm doing the videos because it really does impede the way that I speak. But I'm hoping that I'll learn how to talk with them and it won't be an issue after a while. It's just going to take me getting some used to. But anyway, now that I've gone on for 3 minutes talking about myself and all kinds of other stuff, then what I needed to talk about in today's video, like I was saying, after doing yesterday's video, and I was speaking about, the fact that if you have, any kind of blood when you throw up, either red or if it looks like black coffee grinds, that you really need to go to the doctor. And that also includes if you are having blood coming out the other end as well. If you're having like black or tarry stools, another thing to look for as well is if your stools are starting to look like really pale, and they're like, if they're floating, if you're noticing any like grease floating in the toilet. And I know this is pretty nasty stuff, but it's the reality of it. And, I'm here to talk about, awareness on this and, try to bring some education to people. And it's just the nature of the beast. But once again, if you're noticing that your stools look different, especially if they're black, and like I said, if you're having grease floating around the toilet, those can be indicative of like pancreatic problems. But also it could be, you're having internal bleeding if if your stools are looking black or tarry. So either way, if it's coming out of your mouth, if you're throwing it up, or if it's coming out the other end, it looks like there's some blood in there, you definitely need to seek medical attention. And that's what I wanted to talk about today, because one of the things, if in fact that's the case and you are experiencing something like that, when you go to see a doctor, they're probably most likely going to refer you to a GI. And a GI doctor is just a gastrointestinal doctor. And when you go see that GI doctor, they're most likely going to order for you to have an endoscopy done. And the reason I want to talk about this today is that I just want to bring a little bit of insight into what goes on with an endoscopy, what it is, and just kind of bring a little bit of some education to it, just so if in fact this is something that you might have to do, just to let you know what it's like, because it's not that scary, and it's really not that bad. For one, like I was saying in yesterday's video, they're going to want to take blood, and taking blood is taking blood. Some people hate needles. I get it. I don't mind it. I've been pricked so many times at this point now. It doesn't feel great when they put that needle in, but it's not that bad. But like I said, they're also going to want to do an endoscopy most likely. And like I was saying, I just want to bring a little bit of awareness to it and just let you guys know it's not as scary as you might think that it's going to be. It's really not bad at all, and that's what I want to talk about today. So what is an endoscopy? Well, endoscopy basically is when they take it's just basically like a tube that's got a camera. It's like a flexible tube with a camera and a light on the end, and they run it down through your mouth down your throat, and they'll look in your esophagus, and it's basically a look at the upper GI system in your body. So they're looking at your throat, your esophagus, your stomach, and your upper lower intestine. And when they do it, they do place this thing inside of your mouth that basically holds your mouth open, and then it's got like a hole in it, and they run that camera down through there. But the one good thing about an endoscopy is that you're asleep, so you don't even know what's really even going on. The one thing about having an endoscopy done is it's outpatient, so you will most likely have to go to a hospital to have those done. I've never had one done at a doctor's office. There might be some doctor's offices out there that do them, but I've never had one done at a doctor's office. Most likely you're going to have to go to a hospital, and they do put you under. And the one thing about being put under is that, you're going to have to fast. They don't want you to eat or drink anything for at least 8 hours before they do that procedure. They're probably going to most likely tell you, no food or drink after midnight the night before that you're going to have that procedure done. The one thing that I will say, and I've talked about this numerous times in other videos before, is that if you do have to have an endoscopy done, when you go to schedule that, one of my tips for you is ask for an early morning procedure. That way you don't have to fast for so long. It is so uncomfortable when you have to go all day long without eating or drinking anything. And my biggest thing is not being able to drink. I can't stand not being able to drink anything, especially early in the morning. I mean, waking up and not being able to have a cup of coffee is like torture. I'm not kidding. Especially when you go to the hospital and you smell them all. Everybody's in there drinking coffee, and you're like, about to have a panic attack because all you want is a cup of coffee. I just love my coffee in the morning, and I hate having to wait to have it. So I always try to get the earliest appointment that I can. That way, only have to fast basically from midnight until like 7 a.m. Go in and have the procedure. It doesn't take long at all. And before you know it, I'm back awake. And the first thing I do is ask the nurse if they could bring me a cup of coffee, because they've always got coffee on the floor. And they always bring it to me. Now, it's not going to be the best coffee in the world. It's not going to be like Starbucks or anything, but it's good, especially after you just wake up. And that's one thing too. When you wake up from having your endoscopy done, I would absolutely ask for a nice hot cup of coffee after that procedure's done, because you're most likely going to have a little bit of a sore throat. And because they're running stuff down your throat. They're most likely going to scratch the back of your throat, and that hot coffee really does help soothe your throat after that procedure, and it just makes it feel better. So I would highly suggest that. Maybe bring a couple of like lozenges or maybe some mints in there with you, because you will have a little bit of a sore throat after they do that procedure. But once again, an endoscopy, like I said, it's just a camera with a light on the end that goes down your mouth, and it goes down through your throat, and it gives them the opportunity to take a look around. They'll look at your esophagus. They check for varices. They can check for bleeding. They can look for ulcers, any kind of growths that are going on inside of there, any kind of infections or any kind of thing like that. It gives them the opportunity to take a really close look on the inside of your stomach, your esophagus, and your lower intestine, and just see what might be going on with you. Now, in an endoscopy, they're not really going to be doing much else. They can take samples while they're in there as well. So they can use a device and go in there and cut like a little tissue sample or something like that out and take it out, like a little biopsy, to take a look at, maybe if you have an ulcer or something, they can check it. But for the most part, in an endoscopy, they're not going to be doing any kind of like really, any kind of procedures or anything. That's when you start to get into like the ERCP, which is basically the same thing, but they use other tools and other methods. And when they're doing an ERCP, that's when they go in there and they might, place stents in your pancreas, which I've had done a whole bunch of times. They can also, do work on your gallbladder in an ERCP. There's a lot of stuff that they can do. They can drain off cysts on your pancreas, and I think they can do the same if there's like something on your gallbladder and stuff like that. But ERCP is a little bit different. It's basically the same thing, but they use like tools and stuff like that, and they really focus on the pancreas and the gallbladder when they're doing that. But in an endoscopy, they're really just going in there and just taking a look. I think that in an endoscopy, they can also, burn some vessels. If there are like some blood vessels that are bleeding, they can burn them and stop the bleeding. But like, I'm pretty sure that when they're doing like ERCPs, that's when they'll go in there and band off varices and things like that. So that the ERCP is going to be more of them going in there and like actually doing some stuff. The endoscopy is more of just an observational tool that they can use to go in there and try to find out what's actually causing you the problems. And like I said, if you're having gastrointestinal bleeding, they're most likely going to want to do an endoscopy. But there are other reasons that they'll do it as well. Like I said, if there's an ulcer, or there are some other things that they will do that for. So, especially if you're having any like really bad heartburn, abdominal pain, difficulty swallowing, or like I said, gastrointestinal bleeding, it gives them the opportunity to collect tissue samples, like I said, to test for diseases and conditions that may be causing anemia, bleeding, inflammation, or diarrhea. It can also detect some cancers of the upper digestive system. And it says here as well, they can treat some stuff. Special tools can be passed through the endoscope to treat problems in your digestive system. For example, an endoscopy can be used to burn a bleeding vessel, to stop bleeding, widen narrow esophagus, clip off a polyp, or remove a foreign object. So an endoscopy is sometimes combined with other procedures as well, such as an ultrasound. An ultrasound probe may be attached to the endoscope to create images of the wall of your esophagus or your stomach. Endoscopic ultrasound may also help create images of hard-to-reach organs such as your pancreas. Newer endoscopes use high-definition video to provide clearer images. Many endoscopes are used with technology called narrowband imaging. Narrowband imaging uses special light to help better detect precancerous conditions such as Barrett's esophagus. There are some risks that can come along with this, such as bleeding, and I'll get into that in just a second. The risk of infection is there as well. Tearing of the gastrointestinal tract. But all these things are like really low, risk. It happens like one in every like 11,000 patients or something like that. It's a relatively safe procedure that they do. Or else you can also have, a reaction to the sedation or the anesthesia. But that's one of those things too. If you've ever been put under before, and you didn't have any problems with that, you're probably going to be okay with that. But once again, I'm not a medical professional or a doctor, so please, don't take anything that I'm saying as true fact. I'm not a doctor. I'm just talking about things from my experience, and take it as you will. Some symptoms that can mean a complication after your endoscopy are fever, chest pain, shortness of breath, bloody or black or very dark colored stools, difficulty swallowing, severe or persistent abdominal pain, vomiting, especially if your vomit is bloody or looks like coffee grounds. So these are things just to look for after you have the endoscopy done. And if you do have any of those things, please go see a doctor and let them know. Some things that you're going to need to do to prepare for your endoscopy, like I was saying just a little bit ago, you're going to have to fast for at least 8 hours before the procedure. So that means no food, no drink. And majority of the time, like I said, they're going to tell you after midnight, before no drinking or eating after midnight, and then you'll have your procedure, but you can go back to it afterwards unless they tell you otherwise. Another thing that you're going to have to do, and this is a big one, is stop taking certain medications. And one of the things that they always gave me a hard time about, well, not a hard time, but they would just tell me, we don't want you taking this, is I used to take Jardiance, which is diabetes medication for type 2 diabetics. I don't take it anymore, but they're going to tell you not to take your diabetes medications, and they're also going to tell you not to take your insulin as well, because they don't want you to, get hyperglycemic in the middle of the procedure. Another thing they're going to want you not to do is that you cannot take your blood thinners like 3 days leading up to the procedure, because if they do accidentally nick something and cause you to have a bleed, it's going to be big trouble, and they're not going to want you to do that. Now, one of the things that they will do, and what they have done with me, because I cannot skip out on taking my blood thinners, is they'll bridge me. So they'll have me take Lovenox for 3 days leading up to the procedure, and I give myself an injection every 12 hours with the Lovenox. And that, I'm not going to lie, is not a lot of fun. The Lovenox shots are pretty painful. They do kind of sting when you give yourself those shots, and they leave a big whelp on my leg when I give myself that, and it really leaves bruising, and the bruising stays there for weeks after I bridge every single time. Another side effect that I get from the Lovenox, and this might not be everybody, but I always get really bad diarrhea from the Lovenox. I don't know why, but every time I take it, it causes me to have a pretty upset stomach. So just something to look out for. There's some other things here. It says like high blood thinners may increase risk of bleeding. Certain procedures are performed in the endoscopy. If you have an ongoing condition such as diabetes, heart disease, or high blood pressure, the provider may give you specific instructions regarding your medications. So sometimes they don't want you to take your blood pressure medication because they don't want you to drop too low, but it all just depends. You're going to have to talk with your doctor about that. Another thing as well is that you are going to have someone drive you to the hospital. They will not do the procedure if you do not have a driver. And that driver is going to have to sign a piece of paper in the beginning, and then they'll give your driver a little slip of paper that has your patient number on it. And a lot of times they'll have a little screen in the waiting room, and it'll have your name's not up there, but it's got your patient ID number up there, and it'll let them know. It'll tell them, like if your number is 1, 2, 3, 4, 5, it'll say 1, 2, 3, 4, 5 in progress or in recovery or whatever. And a lot of times too, they'll come and they'll get your driver, and they'll say, hey, they're done, they're in recovery right now, you can go ahead and come on to the back now if you would like, and they can come back there and speak with you. But you will need to have a driver. They do not want you driving after this procedure. They're going to make you sign some documents, you know, saying that you won't go make life-changing decisions after that procedure. You know, you're not going to go sign your will or any of that kind of stuff after that, because, you know, the medications that they put you on do make you a little bit loopy, and they don't want you to do any of that kind of stuff for at least 24 hours. During the endoscopy, during an upper endoscopy procedure, you'll be asked to lie down on a table, on your back or on your side. And as the procedure gets underway, monitors are often attached to your body. This allows them to check your blood pressure and heart rate and all that stuff. They will put those little sticky things all over you and attach little stuff to you. You may receive a sedative medication, and they're going to put an IV in your arm. And once they place that IV, that's pretty much it. And then they'll just administer the medication through that IV line. It says here an anesthesia may be used in your mouth. So I guess like something that they can, an anesthetic may be used in your mouth. They'll spray it in there to kind of like numb your throat while they do it. And then the endoscope is inserted in your mouth, it goes down, and then you know, you're not going to feel anything because you're going to be asleep. But that's pretty much it. The one thing too that you will probably notice after you've had an endoscopy is that you're probably going to have some bloating and some gas. You know, I'm pretty sure that they kind of fill your stomach up with gas to kind of blow it up so they can look around in there a little bit easier. So you are going to feel a little bit bloated after the procedure, so just be mindful of that. It's not anything weird, and it goes away. It doesn't take long, and you might have some cramping, and like I said as well, you're probably going to have a sore throat after the procedure. But that's pretty much it, guys. Endoscopy is not that bad, and you know, it's one of those things that comes along with the territory, and it's nothing to be afraid of. It's relatively simple. It doesn't take very long at all. You know, if you do like I said and get your appointment for early in the morning, you know, you're gonna go in there. Let's say you get it at 8 o'clock. You know, you're going to go back there. They're going to make you take off all your clothes. You're not going to be wearing any rings or any of that kind of stuff. They're going to make you take your glasses off. Of course, your hat or whatever you have that on. They're going to make you, if you do have partials or dentures or any of that kind of stuff, they're going to make you remove those because they don't want that stuff sliding down your throat in the middle of the procedure. So that's one of those things. I would just go ahead and take all that stuff off before you even get there, especially like your rings and stuff like that. Sometimes our rings can be kind of tough to get off, especially if you haven't taken them off for a long period of time. There are some tricks. There's like, if you get on YouTube, there are some tips and tricks to getting like tight rings off your fingers. Like one of them, I've had to do this before, but you take a piece of string and you wrap it around your finger and get it on there really tight. This ring right here can sometimes be kind of hard for me to get off depending on the day. It just really depends. If I like drank a bunch of fluid the day before I ate a lot of salt or something, this can get kind of tight. So there's been times I've had to take thread and wrap it around my finger really tight and then get the ring off, and the string comes right off, and it's super easy. But just check out some of those videos on YouTube on how to remove a ring with, that's been tight. I would go ahead and get those off. Like I said, you don't want to be sitting there panicking. If you're anything like me, if you feel like you're holding people up, you're going to start to get a little freaked out, especially if the ring won't come off, which has happened to me before. And I know they're like tapping their foot, like, let's go. And I'm trying to get the ring off my hand, and I couldn't get it off. And it was this big ordeal, but I finally got it off. But just go ahead and have that stuff off. Take your earrings off, all your jewelry off. Take your partials out before you get there or whatever. You know, anything that's loose, that, you know, any kind of jewelry, just go ahead and get rid of it before you get to the hospital. That way you don't have to worry about losing anything or any of that kind of stuff. It's off already. And I would wear some really loose fitting clothes, something very comfortable, stuff that's very easy to get on and off, because you are going to have to remove all of your clothes before the endoscopy's done, and they're going to make you put a gown on. It's just, you have to do it. And you are going to, I think, most likely going to have to remove your underwear. They might let you keep it on, but they're going to make you take your socks off. They're going to give you those little socks with the little grips on the top and the bottom, because they don't want you to slip and fall after the procedure if you have to get up and use the restroom or anything. So like I said, I would just wear something that's super comfortable, super easy to get on off, like some like sweatpants and a sweatshirt, and some easy to get off socks. And, I would wear some shoes that just slip on and off your feet. It just makes everything so much easier. Because when you do wake up from the endoscopy, you probably are going to be a little bit groggy. And they're probably going to give you a little bit of pain medication just to make sure that you're not hurting after the procedure. They're going to give it to you while you're having the procedure done. And you're probably going to be a little bit loopy when you wake up. So, you don't want to have a bunch of stuff like belts and all that kind of stuff that you're going to have to put on after the procedure's over with. Just wear something that's elastic and just slides right on and off. That way, after you wake up from the procedure, you can put your clothes right on. And after they tell you that you're good to go, your ride can go get the car, and they'll pull up to the front of the hospital, and they'll call transportation. Transportation will get a wheelchair, they'll wheel you out, and you'll hop in the car and you'll be gone, and you'll be on your way for the day. It usually takes them like a day or two or whatever before they really know what's going on. Sometimes they'll give you the results right there in the hospital, but it all really just depends. But it's one of those things I wouldn't expect, and I'll just be honest with you guys, I wouldn't expect to have a long, drawn-out conversation with your doctor after the endoscopy or before the endoscopy. When they schedule those endoscopies, the doctor usually has a whole bunch of them scheduled for that day. So they're going to be turning and burning all day long. They're gonna get you in, they're gonna do your endoscopy, they're gonna take you back to recovery, and they're gonna be done. And they're gonna be trying to hurry up and get the next patient in, because they've got a schedule to keep, they've got people that they need to get in and out of there. So like I said, I wouldn't expect to spend a lot of time with your doctor. Don't be disappointed after the endoscopy's done that your doctor didn't spend an hour with you discussing everything that's going on. They're probably gonna schedule an appointment with you for a later date to sit down and discuss what they found while they did the endoscopy, because they just don't have a lot of time that day, because like I said, on the days that they do those, they've got bunches of them scheduled in the same day. So just don't be disappointed if they don't spend an hour with you after the procedure. They never do. And like I said, it's just because they've got so many of them scheduled for that day. The doctors usually have a couple days or a day that they do a bunch of procedures, and then they'll have one day a week or a couple days a week that they do, sit down with the patient and go over all the findings and all that kind of stuff. Or they might want to do a virtual appointment with you. And ever since COVID, they've been doing a lot of that, which is really nice. You can go do your endoscopy and then have a virtual appointment with your doctor for a later date. And you can just be in the comfort of your own living room, speaking with your doctor, because you don't necessarily have to be there for that appointment. Because if in fact they do find something wrong, most likely they're going to schedule another appointment for you to come back in and have an ERCP done or whatever, another procedure, and that'll be scheduled for a later date. But once again, I just wanted to talk about this today and just kind of ease a little bit of the fear for anybody that might have to go have an endoscopy done. If you're at home right now and you've been experiencing some of the signs and symptoms I was discussing yesterday, let's say that you have thrown up and you threw up some blood and you've been afraid to go to the doctor because it's not something that anybody looks forward to. Let's just be honest here. No one looks forward to it. And there's a lot of reasons why. It's the fear of the unknown. It's the fear of what are they going to find. But don't be afraid of that. That's why I'm talking about this today. I'm trying to bring a little bit of that unknown away from it so that you guys know what it's like. And I promise you, it is not that bad. Just go ahead and go for it. Go speak to your doctor. Be proactive with this stuff. Yeah, I know, and I've say this all the time. I know this stuff isn't cheap. It can be rather pricey, but you can't put a price on your health. If there is one thing I can promise you right now, is that when your health has failed, and when you're laying there in the hospital bed, and you know that this might be it, there is no price that you could put on having your health back. You would give every single thing that you possess, own, whatever, to get your health back. I can promise you that. There's been so many times I've been laying in a hospital bed and I would have given everything away just to have my health back. Having our health is priceless, absolutely priceless. And being proactive is going to save you money in the long run. It's going to save you a lot of headache in the long run. Not to mention, if you're afraid of having an endoscopy done, there's some other procedures out there that are not as relaxed as endoscopy is, and they can be rather stressful, rather painful, and those I will admit, some of the ones I've been through have been terrible. And it's not like they did anything that they shouldn't have done. It's just the procedure is just not fun. And like I was saying, just being proactive about your health. If you have noticed any of these things that have happened to you, just go speak with your doctor. Let them do an endoscopy and find out. There might not be anything wrong with you. And then you can just, and then move on with your life and stop drinking and not go back to drinking or whatever. But if they do find something wrong, then so be it. And go ahead and move forward, get it addressed. And you might be able to keep some other problem from happening. It really is just worth it to go ahead and do it. And like I'm saying, the reason for today's video is I just wanted to kind of take a little bit of the unknown away from what an endoscopy is, and just take a little bit of that fear away, because it really is nothing to be afraid of. It's a rather simple procedure. About the most that you're going to experience from it is maybe a little bit of nausea after you wake up because of the anesthesia. You're probably most likely going to have a sore throat after it, and it doesn't last long. It'll be gone by the next day. You might be a little bit groggy from the anesthesia. You might have some gas and some bloating, and you might have a little bit of soreness in your stomach, but that's about it. And for the most part, all those things just kind of go away the next day, and you'll be back to normal. But once again, you will need to have a driver, but they'll explain all these things to you before your endoscopy is done. But once again, guys, just wanted to bring some awareness to this, take a little bit of the fear away from it, and just bring some awareness and education to what this is. I've had many endoscopies done, many ERCPs done, and both of them are just not that bad. The ERCPs, depending on what they're doing, they can be a little bit painful, but that's a discussion for another day. I might actually talk about ERCPs tomorrow, now that I'm kind of on this health kick since I just got out of the hospital. So, as a matter of fact, I think I will. I think I'm going to talk about ERCPs tomorrow. So be on the lookout for that, and I'll discuss ERCPs and what that is and what those are like and what they do in tomorrow's video. And those are more, leaning towards like pancreatic issues, gallbladder issues, and that kind of stuff. And once again, I'll talk about those tomorrow. So, guys, thank you so much for watching today's video. I truly do appreciate it, and I hope that you guys have a great rest of your night, and I will see each and every single one of you in tomorrow's video. And with that said, I love each and every single one of you so very much, and I'll see y'all tomorrow. Y'all have a great night.